Hi everyone. Hello, welcome to day 2 of the event of Start a Care Agency. This is, like I said, it's a real pleasure to be here. This is something that I started like 10 years ago, a decade, starting in May this year. It'll be a decade that I've actually did my first event as a coach, as a mentor. So I hope everyone is doing fine. If my team can just let me know that you can hear me fine, that would be great as well. And I just want to just say hi. Hello, how is everyone getting on? I hope that you've managed to learn from the training from yesterday, and then you've actioned the steps that was needed, because you know that's so important. So you can hear me. Excellent, wonderful. I'm glad that you can hear me loud and clear. So how is everyone doing today? Excellent, wonderful. Thank you so much, Jed. Thank you. So today is day 2, and boy, have we got some teaching to do today. So I hope you got your pen and paper ready and that you're ready to learn, because I really want you to take some notes and really become a part of this event as well. So I'm really pleased that you're here. Thank you. So let's look at this. You're going to be building your foundation. You're building your foundation, and what is that for you? You're going to be crafting your own agency blueprint, and you need to make sure that you are able to do that, because if you don't create your own blueprint, thank you. Hi, Catherine. If you don't create your own agency blueprint, then you're just going to be like every other Joe Blogs out there in the field. So I just want to basically reach out to you. I've got my massive notepad here that I've just leaned on there. Hope it didn't pick up too much noise on the mic. So if you can just let me know that you can hear me. Thank you. Good evening. Good evening. Good evening, everyone. So recap of day 1. We did the introduction. We also did some key points. We discussed about you doing the 2%, focusing your business planning on the 2%, so that you're not following what everyone else is doing. We've got to be different. We've got to look at what the real need is for 2024, and then look at implementing it, because if we don't, someone else is going to come right behind you and just take over, and then you're going to think, well, I was going to do that. So now is the time to really start making a difference for your community as well as for you as well. This is something which you enjoy to do. So we're going to talk about today about licensing, exploring the legal requirements. I am not a lawyer. Okay, I'm not a lawyer, I'm not a solicitor. However, I've been in healthcare for now 30 years, and I've ran healthcare businesses, and I've helped clients to run multiple 7-figure businesses. I've had a multiple 7-figure business in my care agency as well. So I can talk to you from a business coach point of view, but not in terms of a legal point of view. I can tell you about what the requirements are, for example, the licenses, the certification, the necessary things that you need to establish in order to operate a care agency compliantly, because you need to be compliant. So I hope everyone's got their coffees and teas. I've got my tea here, as well as I've got my water. So I'm going to just have a quick drink here. No special mug today. So think about what you're going to be doing, because if you're a recruitment agency, you'll be learning the effective tips like you did yesterday, some strategies for attracting. We're going to go through attracting, hiring and retaining skilled care workers, and also your staff members as well. Day 3 will go into marketing and things like that. But I just wanted to do a quick recap. Has anyone done their business plan? I hope that you have, from the training that we did yesterday. I hope that you're aware of what the income levels it is that you want to receive for your healthcare business. Now let's delve into some of the legal requirements. Licensing, regulations for care agency in the UK. I'm going to talk about the US as well, so don't worry about that. I will also be doing a event for Cyprus. For anybody that's interested in starting a recruitment care agency in Cyprus, I can definitely help you with that. And because I've been there, I've done it, I've worn the t-shirt, I've passed the exam. For example, I needed to see what the need is. This year I'm doing the home care, registering as a home care provider in Cyprus. I started learning Greek, and I needed that for the exam for the recruitment care agency side of things, because you do have to be licensed just like with CQC, but it's a bit more stronger than CQC actually, because I had to attend college, management college, for 4 weeks solid, and then I had to have an exam for 3 hours to pass the exam. Then before the exam I had to meet the inspector and speak with him for 2 hours. This is in Cyprus, this is, and the exam and the lessons were in Greek. So when it came time to my PowerPoints, I had to have them translated into English so that I could understand, even though I was kind of getting a feel of what was being said anyway. And then the exam was in Greek as well, and I had an interpreter, and she helped me with telling me what the questions were, and then I was able to give that correct answer. So if anyone's interested in that, you can definitely let me know and I can help guide you through that as well. But today we're going to talk about the UK and the US. So in the UK, the legal requirements: if you are a home care agency, a domiciliary care agency, you've got a managed service where you've got a registered manager and you are providing care in the community, then you need to be registered with CQC, the Care Quality Commission. They will do an inspection, and it usually is about 2 to 4 hours depending on what the inspector finds in terms of what they feel that they need to ask you questions about, to make sure that you've got a good understanding of the Health and Social Care Act fundamental standards and the 5 environments, for example. So however, if you are looking at providing an introductory agency, then you don't need to register with the Care Quality Commission because your contractors are self-employed. So it's not a managed service because they will be managing the delivery themselves with the client, for example. So I just wanted to mention that. So the Care Quality Commission is the registration board here in the UK, and care agencies that are providing domiciliary care must register with the Care Quality Commission, also known as CQC. Then who is CQC? CQC is an independent regulator of health and social care services. So registration involves meeting specific standards and related safety, effectiveness and quality of care. So you will need to also ensure that whether you're running a domiciliary care agency or recruitment care agency, and I'll go through recruitment care agency now while I'm speaking about that before I go on to the DBS section. If you want to run a recruitment care agency in the UK, you don't need to be registered with the Care Quality Commission. You just need to make sure that your staff members are compliant and that they're able to do the job effectively and that they've got all the mandatory training in place. They can be healthcare workers, support workers, nurses, for example. You can provide nurses, healthcare workers into places like hospitals, for example, private hospitals, county councils, for example, care homes, for example, if you're providing a recruitment care agency. And I always say that if I was to do things the other way around, I did CQC first. Back then it was C-Sky, for example, and CQC. But I did that first, but I really would have, I really should have done, this is my opinion, I really should have done a recruitment care agency, because I did the recruitment care agency after I got registered for my dom care and my nursing agency. So I was providing nurses in the community registered with the Care Quality Commission to provide nurses into people's homes to do medication, for example. Okay, I then from that point set up a nursing agency where I was providing nurses and healthcare workers to care homes, to hospitals, etc. So those are the orders that I would have switched it round. I would have done agency first, and then I would have done nurses in the community, and then I would have done domiciliary. Okay, that's just my opinion after what I'd experienced in the 20 years of doing healthcare businesses, for example. So one of the things you need to make sure that you do is that you have to, that staff members are, they've got a disclosure and barring in terms of DBS checks, that they are no records found, and that it's clear, it's enhanced, for example. Usually, sometimes you may come across where someone does have a record, but it all depends really on how long ago it was and what happened. You know, it could have been something that happened from when they were 17 years old or something like that, or it all depends, but you need to get them to write a statement of what happened and how they would deal with this today, for example. So I just wanted to briefly explain that to you now. DBSs, CRBs, criminal records checks, they usually take, they can be 1 week, it can be 2 weeks, it can be 4 weeks, it can even be 3 months. It depends on the person, and also it depends on how much the police have got on, because they're the ones that have to do checks as well. Okay, so bear that in mind. So another thing that you need to think about is employer's liability, and that means that you will need to ensure that you have your insurance. Okay, so there's employer's liability, professional indemnity, and public liability. So usually you make sure, usually it's about 2 million cover for each one, or it could be 5 million for employer's liability, 5 million for professional indemnity, 5 million for public, for example. It all depends on the type of contract that you're looking to get from a buyer to use your services. So check what that requirement is, and then you make sure that you've got the relevant insurance in place to meet the needs of the contract, so that you're able to supply staff, because nobody is going to take you on, or no one's going to give you a contract if you don't have the insurance in place. Now, one caveat here is with the Care Quality Commission, if you're doing CQC, all they require right now is that you have an insurance quote, okay, and that you intend to get the insurance once you passed your CQC registration, your Care Quality Commission registration. So bear that in mind. If you're a recruitment care agency, for example, some of the contractors may say, okay, have you got a quote? Upload that quote. Or they may say, have you got insurance? And you say yes. Or if you say no, they'll say, will you ensure that you do have the insurance ready for if you are selected for this contract. So I hope everyone's getting to grips with what I'm saying here. I'm just going to drink my water here because this is live. Sparkling water, it's lovely. So think about your insurance, because you need to make sure that you cover all aspects. You want to make sure that you're safe and that the clients are safe, as well as your staff members, okay? Because just in case there's any workplace accidents or injuries, or in the client's home, for example, or in the care home, or in the hospital, whoever it is that you're supplying the service to, you need to think about your insurance and to make sure that it matches what it is that they are requiring from you as a provider. So the next thing is compliance standards. So let's talk about that. So there's Health and Social Care Act 2008. There's lots of different acts, to be honest. It's like you've got to think about all these different acts and what they are. So there's also the Health and Social Care Act 2008, sets out regulations and standards for the provision of health and social care services in England. So care agencies must comply with these standards to ensure safety, for example. There's also the Social Care Act 2014. There's a lot of acts, so I won't go too much into that, because I feel that that is another training on CQC. So if anyone is interested on training, for me to provide training on CQC, just put in the comments here, hashtag CQC training, and I will do a training for you on CQC. So hashtag CQC if you want me to do an additional training for CQC, because I think that would help everybody as well. Because at the end of the day, whether you're registering with CQC or not, you still should be working to the same standards, the same level of standards. Same with if you're working with the NHS. The NHS, they have guidelines for agencies as well. So if you want to be working with the hospitals, for example, you need to look at what their guidelines are for agencies, because you've got to ensure that you've met their compliance, i.e. that there's proper staff checks in place, employment checks, reference checks, DBS checks, that you've got their application forms, that it's signed, that you've done the proper identification, that you have ID'd the person, you check their qualifications, you know that it's real. You also, as real as you can as a normal person, we're not investigators, for example. We also need to check to make sure that the identification which is provided is correct as well, because of the safety of the individuals that we're looking to serve. We need to protect, and also protect the company as well. So let's look at the next thing. So hopefully you'll want some CQC training. Excellent, good, wonderful, wonderful. If I get 5 CQC trainings, then I'm definitely going to be doing that, okay? So I've got, so far, there's 2 people so far, but I know there's going to be more. So I'm going to do it anyway. Just for, even if it's 2 or 1 person, I still would. So let's look here at the National Minimum Standards for Domiciliary Care Agency. So CQC is established national minimum standards for domiciliary care agencies. So we have to ensure that we meet the requirements related to staff, care planning, safeguarding, and service delivery as well. There's also the data protection laws, and that is another training in itself. So if anyone wants data protection law, let me know so that I can do training on that. So care agencies must comply with data protection law, such as General Data Protection Regulation, GDPR, in the UK, as well as abroad. You know, there's lots of different names, but we still have to protect people's information. So to ensure the confidentiality and the security of the client information is correct. So let me know in the comments if you want some GDPR training as well. So I'm going to go further into licensing and regulations for care agencies in the USA, the United States of America as well, because we do have people from around the world in the group, and I think it's important that we cover as much aspects globally as we can to cover everybody in the group. Is everyone enjoying this so far? Hashtag enjoy. So now we're going to talk about the United States. So what are some of the legal requirements? There's state licensing in the USA. Some of the areas don't require you to be licensed as well. So to bear that in mind. So license requirements for care agents vary by state to state. So care agencies, typically home care, for example, need to obtain a license from the state. And there's also medical staffing as well. So there's home care, there's medical staffing, which is very similar to recruitment care agency, nursing agency, for example. Home care services is like domiciliary care services in the UK. So there's also Medicare and Medicaid certification, which is optional. Care agencies that wish to provide services are reimbursed by Medicare, for example, as well as Medicaid as well. So they may need to undergo certification by the centers of both of those as well as the CMS to meet the federal standards. Okay, so business licenses and permits, care agencies must obtain these required business licenses and permits at local, state and federal level as well, depending on the jurisdiction and the specific services that you want to offer. There's also another really good business in the States, which is billing, where that is another training in itself as well. But I just wanted to offset from what I've just mentioned here. So do look out for that further training as well. Okay, so let's look at with regards to home care agency, we're going to be covering the marketing aspect for the UK as well as the US as well. So don't worry about that. We'll also be providing training to do with how to start a care home. So if anyone is interested in how to start a care home or supported living, do put that in the chat here, and I will be doing some training on that as well in the lives as well. Okay, so hashtag care home, hashtag supported living, just so that I know. So compliance standards, state regulations. Each state has its own regulation, so governing the operations of the care agency, covering areas such as staffing, recruitment, there's client rights, quality assurance and reporting of incidents. Now it all depends really on where you're living. So maybe if you're in Canada, it's a bit different from living in a different part of the US. So there's different regulations and standards as well. So be mindful of the state where you are. So home care standards. Some states have established specific standards for home care agencies, outlining requirements for care planning, supervision training, and client assessments, for example. So there's federal regulations for care agencies that provide services. They're reimbursed by the Medicare as well as Medicaid as well. But you must comply with the federal regulations, including the conditions and the participations set forth by the CMS as well. Excellent. Thank you. So I'm seeing the chat. People are commenting about some additional training they would like to have. So that's good. So let's look at building your dream agency. You need to look at attracting and retaining top-notch carers, because it's not just about hiring carers. The carer really has to match the the delivery that you're wanting to do. Okay, so a home care healthcare assistant that's used to doing home care, it is totally different from sending someone into a hospital. They're not the two types of care, types of person, if that makes sense. It's completely different when you go into someone's home and you're helping them to wash and dress, but it's more on a relaxed environment, slower pace, and you might be making a cup of tea or sandwich or doing a meal, for example, in the microwave, whatever, or heating it up in the oven or on the stove, cooking a meal. Whereas when you're in a care home or a hospital and you're a healthcare worker, it is a lot different. It's more fast paced. You are going from ward to ward to ward to ward. Bells are ringing continuously. You are helping to maneuver patients sometimes. For example, you're helping them to get washed and dressed. You may be bringing them their meals, for example, from the dining section, for example. They may need help with their catheter. They'll need help with assisting to the toilet, for example. Yes, these things still happen in the community, but in the hospital it's more fast paced. You will have it depends really what ward you're on, whether you're on a surgical ward, A&E ward, elderly ward, for example, mental health. It all really depends, but the pace is different from doing domiciliary care. I just wanted to point that out because there is a difference here. Excellent. It's nice to see your comments in there for me to read. My staff are putting it in the chat for me to read because sometimes I can't see the messages on Facebook as well. So let's look at this. So the dynamics. You want to ensure that you're providing an excellent service. There's no doubt about it. You cannot compromise on this whatsoever. So you want the high caliber staff, the best staff to do the job. That's who you're looking for. You're not going to accept mediocre. You don't want someone average, you want them above average. You want that person will have the energy, they'll have the level, they'll be more focused, they will really be able to do the job effectively so that you in turn get more work coming in for your business, for example. So make sure that you choose the right staff member because that is so important. So it's about having a dedicated team that shares your passion for making a difference in people's lives. You want to ensure that that is happening because they all need to share the same vision. And I'm sure when they do come and apply for a job that they do share the same vision. But you want to ensure that the person's energy levels are high. You don't want someone coming into you and they're like that, and then you're asking them questions and it's like you feel like you're pulling the answers out of them. That's not the type of person that you want. You want to ask them difficult questions. You want to have a list of questions that you're going to ask them at interview to make sure that they can do the job effectively. Otherwise, you're not just there to have a chat with someone. Oh yes, you were very nice, yes, I will take you on. No, you've got to make sure that you have got your answers, you've got your interview questions. Say, for example, about 10 interview questions, like, have you ever had a disciplinary before, for example? Have you ever worked in a hospital before? Talk me through it. You ask questions that's relevant to the position of where that person is going to work. so that they've got experience, because as an agency you need to make sure the person is experienced. Unless you're doing home care, then you can train someone from scratch, from the beginning to the end, until they're ready to go out in the community where they will be shadowed, for example. So for example, in the UK, minimum standards is the care certificate. So you as a provider, if you've got the qualifications as a nurse or management, you can do care certificate training for your staff members. I just wanted to mention that as well. Okay, so make sure that you hire the top-notch care staff as well as nurses as well. You don't want average, you want high level, because you're providing a high level, high need service, then they need to be equipped and competent to do the job and have the relevant qualifications to be able to have a good outcome for those that are using the service. So make sure that you attract the right talent, attract the right candidate. So how do you do that? So you start by clearly defining their qualities, the skills that you're looking for. The caregivers, when I always think about this, why I smiled there is because I always think about that advert, which is, you know, if they're recruiting for the army and it's like, Uncle Sam needs you now, you know, that type of thing. I always think when I'm creating a job description and I'm imagining my candidate, I always have that vision in my mind. Who is that person? Whether they're male or female, who are they? What type of characters do they need to have? What energy levels do they need to have? Because it's not just about delivering the care. Yes, that's important, but the character, the personality, the patience, what level are they? And if anyone wants me to do training on here on DISC is about, it's a profile, it's a personality character profile type of thing, and it will let you know whether that person will be good for being in that position as a carer by them taking that test. It is a free test and it's so simple, and it will say that that person is really suitable for a position as a carer. We as care providers, we don't tend to do this, and we should, because we want to make sure that we're making the right decision and the best decision for the company. And if you can adapt this where you use the DISC method, I mean, I've used it with my staff members. I think some of them might tell you in here that they did do the DISC as well, because I think it's important so that you know the type of character that you're taking on, for example. And it's not 100% proof, because, you know, things can slip through the cracks as usual, but at the end of the day, you've done your best with that candidate, for example. So consider factors such as empathy, communication skills. What do they have? Are they communicating with you? Because at the end of the day, if they're doing home care, they're going into service user's home, the client's home, the client is there by themselves. They possibly have not seen people for, you know, a day, or, you know, they're lonely. So you want someone that's got good communication skills, good listening skills as well, and that they're reliable and that they've got the relevant experience. So make sure when you do your job description, you want to write the job description that highlights the rewarding aspects of working for your agency, such as the opportunities. Make it meaningful and to impact clients' lives in a positive and a supportive way. And also you want to build a good work culture as well. And you want that person as well to be part of a team, not separated, for example. Okay? So be transparent about the job, what the requirements are, what the responsibilities are, and the benefits. Because if you, for example, you take on, let's say if you was looking for a carer that was going to be looking after a young person, for example. Now, if you've got a carer that's been used to looking after the elderly, the dynamics are slightly different, aren't they? Right? So when someone is looking after a young person, for example, in a children's home, I'll give that as an example, their energy levels are completely different. So you're going to have to go for long walks sometimes, for example. You're going to have to take them in the car to activities, pick them up. You may have to drive them to their parents or to a contact center, things like that. So when I was in the children's home, we would drive from, say, Sussex to Portsmouth and then drive all the way back. And then we'd have to come pick them back up if, things didn't work out, or we'd pick them up the next day or on a Sunday. Whenever the young person wanted to be picked up, we would always pick them up, for example. Okay? So that person, the job description needs to reflect the position in the correct way, because not everyone is going to be suitable for a particular type of service that you're providing. So they need to be experienced as well. So making sure that you have crafted your job description is very important. And what we need to look at as well, you need to utilize there's quite a few recruitment channels, for example. You want to cast a wide net by leveraging various recruitment channels, including job boards. So things like Indeed, social media platforms, professional networks. There's local community organizations, for example, that you can engage with potential candidates through targeted outreach, networking. You can see them on LinkedIn, approach them on LinkedIn, because they'll say, for example, I'm open to job opportunities, for example. You can even create a Facebook group page for vacancies for your organization. Now you must be set up, ready to go, and that you're looking for candidates, okay? Take it seriously, because it's not fair on the candidates to be approached and thinking that there's work when you haven't even registered your company yet, for example. Okay? You want to offer competitive compensation and benefits if you choose to, but if you are looking at self-employed, then there will be none of those, because when you're running an agency, usually the candidates work on 0-hour contract, for example, and they will work as and when needed. So bear that in mind. So your employment contract needs to reflect what it is that you're offering, because if you're doing a temporary agency, then you can't be, even with home care, it has to be a 0-hour contract, because you never know, you could lose a contract at any time. And then if you said to someone, well, I'm going to give you 40 hours a week, for example, then what happens when you lose that contract? So be mindful. So usually we say 0-hour contract, so they can work as and when, because it's meant to be flexible for them as well as for you as well. So remember that by offering these benefits, like referrals, for example, if they refer someone, then you could give them that as a benefit. Or if they've done so many hours, for example, they've covered so many shifts, then you could perhaps give them a pamper day, So you want to look at retaining your staff members, your candidates, for example. So cultivate a positive work environment, create a supportive and inclusive work culture where employees feel valued, respected, and appreciated. Foster open communication as well, recognize achievements, and provide opportunities for input and feedback as well. So you want to invest in training and development to empower your team as well, so that you're investing in ongoing training and professional development opportunities. You want to offer workshops, seminars, certifications to enhance their skills, knowledge in caregiving and administrative roles, for example. So there's quite a few things that you can do as benefits that you can offer to to a candidate so that they come to work for you. Just drank my water there. So, like I said, you want to promote work-life balance. Recognize the importance of work-life balance and encourage employees to maintain a healthy balance between work and personal life. Offer flexible scheduling options. Well, they can't really do telecommuting because they're doing home care. They can't do that. But there's other things that you could possibly offer to them if they, perhaps needing some time off, but not where they're out in the community. Maybe they can do things in the office or maybe from home, for example. Okay, what other things can you look at offering them? Because it's important to maintain their stress levels, because if you can offer like pamper days and encourage work-life balance, because you don't want your staff members to get burnt out. Now, I explained before previously what I used to do. Remember, I said I used to get up 5 o'clock in the morning, for example. I was up anyway at 4 o'clock in the morning, but 5 o'clock I would start getting ready, and then I would be at the first client for 6 o'clock in the morning, and then I would finish at about 8:30, then get into the office at 9 o'clock in the morning, so I'm there ready for when the business starts. And then I perhaps might pop out at lunchtime if there was a shortage of staff, for example, to help so staff weren't overworked. Then at the end of the day, about 4:30, I would close the office. I'd have the on-call phone with me, or the staff member senior would have the on-call phone with them, for example. And then I would go out and I would do some rounds from, say, get to the first person about 5, service user about 5 p.m. And then I'd finish about 7, get home for 7:30. Okay, so that I did that because I wanted my staff not to be overworked or to become burnt out. I want to encourage them to have work-life balance, and you should do the same as well. So recognize the importance of work-life balance and encourage employees to maintain a healthy balance. Okay, provide opportunities for advancements as well. So create a clear pathway for career development, advancement within your agency. For example, they start off as a carer, and then you promote them to senior carer. Then you may promote them to team leader, or you may promote them to care coordinator, or you may promote them to assistant care manager, or you may promote them to being the manager, for example. So that's an example of how you would look at the career advancement. What else could they possibly do for your organization to help them to feel that they are progressing within your organization? So you could offer a mentorship program, leadership development initiatives, and promotional opportunities based on performance and their merit as well. So foster a sense of purpose, emphasize the meaning of work done by the team and impact that they have created for the client's lives, that it's a good outcome. Share success stories, celebrate achievements, and reinforce the importance of their contribution to the agency mission, and goals. And I hope that yesterday you did your mission and vision, and we will go into that shortly as well. So remember, building your dream team is an ongoing process. It requires dedication, creativity, and a genuine commitment. By implementing these strategies, you'll attract, retain the top-notch carers and also your administrative staff who share your passion for providing quality care and making a positive and a difference in the lives of those that you serve. So now we're going to go on to vision statement. So I hope that you've all got your notepad ready and a pen. Hashtag vision statement. So now we're just going to talk about vision statement. So to become the leader, the leading provider of a compassionate and personalized care services, empowering individuals to live fulfilling lives with dignity and independence. So what is your vision statement? What do you think would be your vision statement for your organization? So you want to be the leading provider. But what do you want to be the leading provider of? Can anyone answer that question? What is your vision statement? And what is it that you want to be known for in your care agency, for example? So what is the leading provider? What do they do? What do they want to be known for? What do you want to be known for? So make a note, write down your mission statement, your vision statement, for example. So now we'll go on to mission statement. So your agency, for example, what is your mission statement? Is your mission statement to provide exceptional care, support to individuals of all ages, abilities, fostering and nurturing an environmental where each person's unique needs and preferences are respected and honored? And this can be done through dedicated team carers, support workers, nurses, for example, and staff, and that you're committed to enhancing the quality of life for our clients by delivering compassionate, reliable, and client-centered care services tailored to their individual needs. You want to strive to provide a standard of excellence as well. So you want to be the trusted partner in promoting wellness, for example, independence, dignity for those that you serve, ensuring that every individual that you touch receives the highest standard of care and attention. So with this mission and vision statement, it will also emphasize that the agency that you're providing is committed to personalized care, dignity, independence. You'll also be looking at what are the aspirations that you want to provide to become a leader. So what is your purpose? What is your values? And what is your vision for the future? Which will inspire and it will help guide your decision within the organization, for example. I hope that's been helpful. Yeah, excellent, changing lives. That is absolutely true. And what I want to also say to you all is I want you to spend time writing your mission and your vision, because these are part of you. It's part of you. It's coming from you. It's in your heart. Bring out what's in your heart within you, and you will then create a good mission and vision. And yeah, Janet, you said changing lives. Exactly. Exactly. It's important that we get to understand our mission and our vision statement, because we need to really, it really needs to align with what it is that you're offering as a business owner. So you're a care provider, for example, and you want to be different, then you need to put in there social inclusion, diversity, the right to quality care. You could really go deep into it, because it's something that you need to plan. It's something that you got to sit down with yourself and just listen to yourself in your heart. Okay, don't listen to outside noise. Put yourself in a quiet room and sit down and write the story of your vision and your mission statement, and close your eyes. Close your eyes and see what that vision is. What does it look like? How are you going to provide a quality service? So I hope that was helpful to everyone today. And I want to know here, has anyone done their business plan? For example, have you done your business plan? Do you know what your yearly fees are going to be? What will you be charging, for example? Are you doing nurses? Are you doing healthcare workers? What is it are you doing that is going to impact people's lives? And I'm coming up closer here, yeah? Because I want to know. So when you get time, you can always reach out to us. Book a free 15-minute consultation with us to discuss your starting an agency, for example. We've still got day 3 tomorrow. Day 3 tomorrow is covering marketing and more things like that, so that we're getting through moving our agency to getting the guide and knowing what the, so that you're aware of what the overview is that's needed for starting a care agency. We will be having our boot camp as well. For anyone that's interested in our boot camp, getting the recordings for the boot camp for how to start an agency, do let us know. But book a free 15-minute consultation with us, and we can go through that with you with no problem whatsoever. But I really want you all to think about your agency and getting it off the ground. It's 2024. We're now in March. Wow. March already. The time is going by so fast. And we have got so many opportunities that we can look at, that we need to look and take our time to really focus on what we really want, so that we can create the best, amazing agency that is around in your locality, because you want to stand out in the crowd. You don't want to be like Joe Blogg's agency down the road. There's plenty of them. Be different. Be you. Be your own agency, not someone else's agency. Be your own agency. That's when you become the winner, and that's when you become real, by putting in the work, by understanding your agency. Then that will be the one that will create the multiple 7-figure business. And it is not easy. It takes time to get it up and running. It's not a get-rich-quick scheme. It is something that needs time to grow. And you grow slowly, because you wouldn't be able to cope with £1 million business in 3 months. You wouldn't be able to cope. It takes time to get to that level. Each level requires a different strength, a different knowledge, a different understanding. You can't start from 0 to 1 million in 3 months in an agency. It's never going to happen. You wouldn't be able to cope. But if you plan it, and it's like climbing the stairs. It's like climbing the stairs. You will get there, but you'll be in control. Just like with a baby, when the baby doesn't walk straight away, do they? They have to move their arms, start moving around, then they start to crawl, then they walk, then they run. You know, this is how life is. There's a process. But you have to be involved in that process, because that is what's going to make you strong inside out. So yes, Janet, of course, yes, you can. If you just book a free call, I think I'll be speaking with you. I'm not quite sure, but your name rings a bell, Janet. So I look forward to speaking with you all soon. I hope that you've enjoyed, I hope that you've enjoyed today's training. I really appreciate your time, and I really look forward to doing more training with you tomorrow. We've also got training next week, and then we're going to have more training the following weeks to come, because you put some hashtags in there, things that you want to hear about. I want to hear what you want to hear about, so I can teach you. Yeah, you got something on your mind that you want to learn about that I can teach you, then just hashtag care home, hashtag supported living, hashtag nursing agency, for example, hashtag children's home. You know, let's build this together. This is what this group is for. Okay, so I hope that you've enjoyed today. I look forward to more training with you tomorrow. I've really enjoyed talking to you today. Thank you so much, all of you, for being here and taking the time. For those of you that's watching the replay, hashtag replay, so that we know that you're watching the replay. The recording is here for you to watch as well. Thank you so much. God bless you all. Thank you so much. Take care. Speak to you tomorrow. Take care. Bye. Have a good evening, everyone. Bye.